DeLauro, U.S. House of Representatives, Connecticut's 3rd District.
Good morning, everyone. I am honored to be sharing this stage today with so many public health leaders, people I admire and respect, including Joshua Sharfstein, director of the Bloomberg American Health Initiative, Dr. Francis Collins, where we worked together effectively when he led the National Institutes of Health, Secretary Javier Becerra, who showed such commitment to those we served at the Department of Health and Human Services, John Feinblatt of Everytown for Gun Safety, who has led the way on advocating for common sense public safety measures like Ethan's Law, and my co-conspirator, Congressman Brian Fitzpatrick, who has worked with me for years to improve access to screenings and care for women with breast cancer. Since 2018, this event has convened the preeminent public health and policy experts from across the nation, drawing on the experience and leadership of Mayor Bloomberg and his foundation's strong partnership with Johns Hopkins University. My thanks go to Mayor Bloomberg for launching this initiative, which now supports over 50 full tuition MPH and Dr. MPH scholarships each year, placing fellows in organizations across this country to work on 5 critical focus areas: addiction and overdose, environmental challenges, adolescent health, food systems, and violence. These issues are all crucial aspects of public health and ones that I have been working on in the Congress for many years. I'm grateful to be here with everyone today, from the faculty at Johns Hopkins, to my fellow speakers, to the organizers and attendees of this conference. You are on the front lines of America's public health battles, and I am honored to be with you today to have the opportunity to share my thoughts on our next steps as a country. I believe that a strong public health system with the capacity, data, and leadership to both respond to crises and to prevent them is essential to the future. When I was diagnosed with ovarian cancer in 1986, it was early detection combined with modern radiation treatments based on decades of scientific research from public health research institutions that saved my life. I say as often as I can, I am here by the grace of God and biomedical research. Not only did these measures save my life, they changed the course of my life. I decided to run for public office to have an impact on women's health, poverty, and so much more. I shaped my priorities in the Congress, including fighting for the child tax credit that is so important for the middle class, working people, and for the vulnerable families in this nation. Today, I'm asked to speak on the role of politics in public health and bridging the divides that face us. And those gaps could not be larger. I must be frank about the challenges ahead. The results of these elections were not what I or many of us were hoping for. But I respect that Donald Trump won the election and won the trust of many voters. However, I do not respect the selection of RFK Jr. as health secretary. Well, public health is not a game where we can walk away from a bad hand or simply wait for our next turn. It is a constant struggle, which impacts the daily lives of over 330 million people. And if we do not do our jobs and advocate for them, no matter how difficult, nothing will get better. It is more important than ever that we look beyond partisan divides for opportunities to work together. And I promise there are still opportunities. I just completed an international trip with Chairman Tom Cole of the Appropriations Committee, where we built out a very strong working relationship, including strong support for the NIH, for Down syndrome, and other health research initiatives. In fact, there is far more teamwork and bipartisanship in Washington than the 24/7 political noise machine would have us believe. Public health has the advantage of occupying the most common possible ground. We all have a brief time on this earth, and we all want ourselves and our loved ones to live the longest and healthiest lives that they can. We must use this fact to find the issues that both sides can agree on. The new administration and their appointees will have priorities that are different from many of the ones that I would choose. But as an advocate, not a partisan, I believe that with new challenges may come new opportunities. We can take this time to look for blind spots that have been allowed to linger in our public health system. For example, I'm already considering opportunities that some of the president-elect's potential appointees have discussed regarding our food safety system, which is a Bloomberg initiative focus area and a crucial input to public health, to use evidence to close loopholes that let corporations self-certify additives and ingredients as safe without sufficient testing. We will have opportunities to focus on preventive care and the impacts of chronic disease, especially beginning in childhood. These are just a few of the areas where I believe cooperation is not just possible, but essential. As a starting point, we must stand firm about the importance of science, not just a word, but as an active process, a constant process of gathering new evidence, testing and retesting our ideas and learning. If we have learned anything from recent years, it is that we must communicate the importance of scientific policy making more clearly to the public and find ways to combat misinformation without shutting down the conversation. We must also stand firm on building a public health capacity and defending key programs and authorities from short-sighted budget cuts. When RFK Jr. claims that as health secretary he would fire 600 NIH professionals on day one, I'm horrified at the scope of those impacts. Just a couple of weeks ago, I listened to the head of the NIH, Dr. Monica Bertagnolli, as she talked about the value of the BRAIN initiative and the breakthroughs made possible by new imaging, giving a physical and physiological picture of what happens to the brain in various mental states. She also talked about the significant progress that has been made in expanding clinical and preclinical trials to include women, an issue where I have led the fight for years. All of these breakthroughs were made possible by consistent levels of funding and targeted increases focused on key objectives. All of those breakthroughs and countless future ones would be at risk with a new administration. RFK Jr. has also said that it is time, and I quote, "give infectious disease a break for about 8 years," end quote. There could not be a more dangerous idea. If we cut back key research programs and lose our progress on innovative therapies, then plain and simple, people will die. The stakes are very real. We have underinvested in public health infrastructure for decades, and the COVID pandemic showed us just how unprepared we were for a fast-moving challenge at a national level. We must protect vital funding and research that helps us to collect data, to modernize our systems, and to retain qualified personnel in key positions. And as we approach the appropriations process for 2025, we need all be mindful of where they may be placing the cuts and stand up and fight back against those cuts to public health. Also on day one, Kennedy claims he will advise the Trump administration to stop all water fluoridation, which has reduced tooth decay in children and adults by nearly 25%, according to the Center for Disease Control and Prevention. And he will amplify his already deadly vaccine skepticism. He's already claimed that a miraculous COVID vaccines were, quote, the deadliest ever made. His record of disinformation and death is long and global. In 2019, he visited Samoa and spread misinformation about vaccine safety, contributing to a measles outbreak that began a few months later and resulted in the deaths of 83 people, mostly children. His organization, Children's Health Defense, has an advisor named Wahome Ngare, who has argued that contraception and health education are part of a global plot to reduce African fertility. It has supported efforts to ban 5G cell phone towers in South Africa over bogus health concerns, and paid a British politician to speak at a European conference opposing pandemic measures and promoting vaccine skepticism. He has even questioned the science behind the AIDS epidemic and insulted its victims by claiming that it was not related to HIV, but instead to environmental toxins and recreational drug use. For a final clarifying perspective on the risks we would face under his leadership, I turn to Scott Gottlieb, Donald Trump's first FDA director, who said about RFK Jr.'s nomination, and I quote, "We're going to start seeing epidemics of diseases that have long been vanquished, and God forbid we see polio reemerge in this country." This is where we are at. The stakes of this fight and the stakes behind every decision that the Health and Human Services Secretary has to make are deadly serious. We must never lose sight of that fact and the people who need our help the most. Good public health administration can be the difference between life and death for many Americans. Our broken healthcare system works best for those who are already well off, for those who are uninsured, chronically ill, or unable to take time off for a treatment, or a simple illness or injury can mean their lives quickly spiral out of control, saddling them with skyrocketing medical bills, even as their health declines. This is why public health efforts are so critical. Poverty, chronic stress, and pollution are real medical threats that exacerbate or directly cause many distinct ailments. These social determinants of health shape our lives in ever-present, often unnoticed ways, setting invisible limits on how healthy we can truly be and the very quality of our lives. I firmly believe that improving public health is inseparable from improving the daily condition of people's lives. This is the fault line with the new administration and where they want to go. We know their record, their efforts to eviscerate the Affordable Care Act and other health initiatives that expand coverage. They do not want to provide the resource or support to communities and neighborhoods, especially those who are impacted by pollution or historic inequality. That will be up to us. That is why I will continue to champion investments in the core capabilities of public health, from data to lab capacity to growing the public health workforce. Good data, good personnel are essential, helping Americans everywhere live healthier lives and contributing to global health resilience. I thank you all once again for inviting me to speak today. I look forward to hearing about the ideas that come out of this conference, and I expect to continue these conversations with many of you very soon. Our mission is there. We have to just take hold and move forward. Thank you very much.
Please welcome